Welcome to Health IQ. I'm Dr. Alan Siegel, your host. Today we have Andrea Gurciullo. She's a licensed acupuncturist with ProClinix. Welcome, Andrea.
Hi, thank you for having me today.
Yeah, so you're welcome. Well, thanks for being here.
Okay.
As a licensed acupuncturist, what are some things that people don't know about acupuncture? I feel like acupuncture is one of those things where people are very curious about it as a practice and as a interventional techniques, but what is it that people don't know about acupuncture and what can you help them understand?
Okay, so first off, so there's different training with acupuncture. So somebody like me is considered a doctor of Oriental medicine. So it's not just strictly acupuncture. So while we do use acupuncture as our main source of treatment for different pathologies, we can also use things like clinical herbal medicine, which are custom herbal formulas. We use techniques like cupping, which is those suction cups, which you'll see sort of right now. We're seeing it all over the news because all the Olympic athletes have these sort of suction marks all over them. We also use techniques called gua sha, which is like a scraping technique, which is usually used for musculoskeletal problems. We use heat therapy, we use breathing therapy. I'm just trying to think of all the other things
So all these therapies that you use in combination, what is the methodology behind acupuncture? What is it that you're trying to accomplish within a person's system and their body? Because allopathic medicine and other types of medicine that people are more familiar with, sometimes they just go to the problem area and they try and treat the problem, whether it's an injection or a pill for this condition or a pill for that condition. How is it that acupuncturists and herbal Oriental medicine doctors approach their patients more on a holistic level?
Okay, so when a client comes to me, I never look at one thing. So Dr. Siegel, if you came to me and said, I have insomnia, right? We'll just use that as an example. I have to look at the whole picture. I have to look at what's causing it. Is it digestive? Is it anxiety-induced insomnia? Is it noise-related? So I don't just throw you a sleeping pill. I'm not going to throw you Ambien. I'm going to prescribe a very specific course of treatment that usually involves acupuncture and the possibility of clinical herbs. Those clinical herbs are very specific to your type of insomnia because Joe Schmo over there has one type of insomnia and Dr. Siegel has another type of insomnia. I have another type of insomnia. So we break it down. Allopathic medicine sees insomnia as all the same thing across the board, right?
So you're looking at different systems, different problems in the other parts of the body that may be causing the insomnia.
100%.
Okay, so which is a different approach than someone that, like you said, just says insomnia. So insomnia, you mentioned anxiety, you mentioned stress. So those are three very important parts of our societal health issues. And I believe those cause other issues as well. Whether it's cardiovascular disease, diabetic, digestive problems, etc. How do you work with patients that have, those issues? Is it the acupuncture plus the herbs? Is it a combination of all of those things? So
I'm going to just use...
And the fact that you can even treat anxiety and stress, I don't think people understand acupuncture can even help that, which is great,
So we look at things a little bit differently. Okay, so allopathic medicine, says stress is always induced by an external source. Like, okay, now there's the COVID crisis going on, so forth and so on. Your marriage is falling apart. These things are causing stress. In Chinese medicine or traditional medicine, whatever you want to call it, we have to look at the physical also. Okay, so we say, why did Dr. Siegel, why can't he handle stress? What is it about his physiology that he can't handle the stress? So we treat it from sort of a physical standpoint as opposed to talk therapy. Does that make sense?
Yes.
We also go over meditation. We also work on dietary recommendations because all these things together can add to the stress you're having, right? So why can I handle stress well and Dr. Siegel can't? So we have to get to the root cause of that, and we look at everything. We look at the medication you're taking, we look at the food you're eating, we look at your sleep patterns, we look at your overall mental health, et cetera, et cetera. So
Now we don't have a Meridian chart here with us, but maybe at some point we can put that into the show here. But explain how, like, if someone has like headaches, why you maybe put, and I'm just using this as a product, for example, why you might put needles in their back or in their knee or in their calf. What is that connection to a headache patient, let's just say?
Okay, so we break down headaches. Once again, where is the headache? Is the headache back here? Is it in the front? Is it due to anxiety? So forth and so on. So different headaches, okay, how do I explain this? In Chinese medicine, there's energetic pathways, okay? So it's like this line that goes from the toe all the way up to the head. I'm oversimplifying it, just. So if somebody has a headache on this side of their head, we usually will needle down by the feet to sort of unblock that energetic meridian, or nerve pathway, whatever you want to call it. And that's what sort of gets rid of the headaches. We also have an order in which we put the needles in. So we always put the needles in the feet first because that descends the energy down, which gets rid of the headache. Because if you ever see somebody, you know that term hot-headed? Hot-headed means all the energy's gone up to their head, they turn red, they're angry, you know, whatever. And that can cause headaches, which is also headaches due to high blood pressure. So we start down at the feet because we want to descend that energy down because we're trying to manipulate the body's energy, which is kind of hard for Westerners to conceptualize because
would you describe this meridian pathway or this nerve pathway? Is it a nerve pathway? It's a little bit different than
it's different than a nerve pathway because it's, you know, they've sort of mapped out these energetic meridians. There's actually 12 of them. So, and different acupuncture points can affect different areas on the body. So if it was just strictly nerve pathways, we're not sure.
And I think it's important for our viewers to know that, you know, whether it's Chinese acupuncture or, you know, Eastern acupuncture in general, you know, it's been around for thousands and thousands of years to the point where it has been studied, it has been, you know, researched, it has been, you know, proven effective for many people. And, you know, in different parts of the world, this is a primary source of energy for people. So, or, you know, primary source of care for people. And they look for herbs, they look for acupuncture as a treatment modality over, like I said, taking a pill for something or having even a surgery, depending on what's going on with the patient and things of that nature. So, you know, you mentioned, you know, COVID before, and, you know, now we're in this epidemic and still kind of going through it. And I think people, you know, with stress, anxiety, lack of sleep, typically what that affects is people's immune system, right? So people start getting run down, they start becoming more susceptible to colds and flus and other issues. And I think that acupuncture, you know, as a modality could be beneficial to help people calm that down. So, and then herbs, you know, possibly certain herbs might help with immunity. So we could talk about like patients that are either hopefully haven't had COVID, if they had COVID, if they're still having symptoms, you know, how to work with those patients on a post-COVID level. How would you work with those people?
So there's different ways, right? So let's just use post-COVID syndrome at this point, right? Is that a good? So typically with post-COVID syndrome, you'll see a lot of things like headache, smell disorders, taste disorders. Even now we're starting to see phantom smells. So Mount Sinai Hospital right now in New York City is actually referring all their post-COVID patients out for acupuncture because they're noticing that it's really helping with all these weird sort of symptoms that these post-COVID patients are having.
They can't just throw a pill at, right? They don't know how to.
Well, they can't throw a pill at it because it's almost like a nervous system disorder at this point. And acupuncture is showing great promise in post-COVID syndrome. And I'm actually seeing clients now and they love it. They absolutely love it.
Are you combining needling with herbs as well for these patients and clients, or?
I'm doing that, and the majority of them, I have to say, I'm doing mostly acupuncture and the results are great. With people, I also get calls from people that have COVID. So in herbal medicine, there are actually formularies that you can use to treat active COVID. I wouldn't take a very severe case, obviously. That's something that has to go to a hospital. But somebody who has mild COVID, you could treat with herbs. I can't go to their house because I don't want to really get COVID, but
Right.
whatever.
Understood. So just working with those patients that have like post their infectious stage, but they're having symptoms, they want to start feeling better quicker. They're finding that acupuncture is really being beneficial. And as you mentioned, a major regional hospital system is referring out for this modality because they see the positive effects for it. So that's good. Now I know people often associate acupuncture with pain and pain syndromes, which there are a lot of, but probably the more common ones that we're aware of are like your sciatica patient, your low back patient, herniated disc patients, patients with neuropathies. Those are the types of patients that you typically will see a lot of, just because I think that is probably the more normal or the more common reason for people to seek acupuncture, at least initially. Not the only reason. There's a lot of other things we're going to speak about today, but how do you assess and work with patients that are chronic pain patients for various reasons?
So with chronic pain, we do our diagnostics. Chronic pain is actually fairly easy to treat from an acupuncture standpoint. You don't really need to use a lot of clinical herbs. Sometimes I'll massage people with some herbal remedies, and more often than not, for something like low back pain, I would typically use acupuncture. Then there's something called acupuncture with electric stim, which gently stimulates the needle. It's subcutaneous stim. And then usually I'll use some variety of cupping, which are those little suction cups. And
most people have heard of electric stim. They've been to physical therapists or chiropractors, and it's probably a similar effect, but now you're putting the electrical current through the needles.
Yeah, so it's a little deeper.
Meridian points deep, okay? So that's great. So people with like herniated disc, they have sciatica, things of that nature, pain down their arms, numbness and tingling, pain in their neck. Again, you're not just treating their clinical condition, which may be, a disc herniation, arthritis, nerve entrapment issues. You're still treating another root cause of it, or a combination of both?
It's a combination of both. So if I get a 20-year-old that has a football injury, right, I'm not really going to look too deeply into the psychology behind it. This is a trauma. It's very simple. So we'll sort of needle the area of where the pain is, and that can sort of reduce the muscle spasm, stop the pain, and get moving forward again.
Now, people have heard the term dry needling. I know that's not necessarily an acupuncture term, and it gets intermingled with a lot of other practitioners, but what is the general premise between the needling of muscles, and what is the effect? People hear of like trigger point therapy, they hear of various things, whether it's spasm or hypertonicity of muscles or overuse syndromes. How would that quote unquote needling effect help patients, and how do you approach that care?
Okay, so dry needling in the acupuncture community is known as direct needling or trigger point, or whatever you want to call it. So what we do is we actually put the needle directly into the area, like the trigger point. That trigger point will help to release that muscle so that it reduces the spasm pretty much immediately. Okay, does that somewhat make sense? It's kind of hard to understand.
You're going into the belly of the muscle. Like if someone, like a lot of people, I'll point to my trap here, a lot of people get a lot of pain up in this area, and they can't necessarily get released. It's a hard area to like work on yourself, or like in their rhomboids, and just getting in there. Now it does sound slightly uncomfortable. Is it generally okay, or is it comfortable for the patient?
Okay, so 99.9% of the time, acupuncture is very comfortable. We use the best needles, first off, because that actually does play a role in comfort for a patient. So I use very expensive needles, not to brag, but there are some situations where acupuncture might be a little bit more uncomfortable. Like trigger point needling, you might feel like a little bit of a dull, achy sensation. And sometimes after treatment, you might be sore for a couple hours. But once that soreness dissipates, people call me because they're so happy that their pain is gone. Right. So there is a little somewhat discomfort, but our needles are very, very thin. if you know medical, it's like a 36 to 38 gauge. We're not pushing any fluid into anything, because sometimes that's what hurts with a needle. So when people think needles hurt, it's because you're feeling a bolus of fluid. With acupuncture needles, they're a filiform needle, they're thin, and they just sort of stay in place for about 20 to 30 minutes.
I've personally had acupuncture, and I've experienced it, extremely tolerable, extremely comfortably, with no, ill effects whatsoever. As a matter of fact, I found it very relaxing, at times just very soothing. And, for 20, 30 minutes when you're just lying there, I think the hardest part is just staying still.
Yeah, exactly.
But other than that, it's a very comfortable experience. And I think, obviously in today's day and age, all needles are biohazardly removed from the office, and people need to know that every needle is individually packaged, so there's no cross-contamination in an office. And I think those are some of the anxieties and fears of people even attempting acupuncture, but it's truly a very, very safe and effective treatment modality. So I think that's important for our viewers to know. And if they haven't tried it for various issues, I think there's a lot of various problems that we can go into now. So another, common thing that, or maybe common to some, is fertility. So a lot of women, at all different parts of their ages and lives are having trouble conceiving. And the use of acupuncture has been widely recognized and widely known. Sometimes in conjunction with fertility treatment, sometimes on its own. Usually it's in conjunction, people are doing, medication with other types of injections, or in vitro, or various techniques to help with a successful pregnancy. So why don't we talk about the fertility and how you work with those clients?
Okay, so there's a couple of clients I get in. Some have unexplained infertility, which I love those cases, because they're actually not always utilizing the reproductive endocrinology field, which is in vitro, IUI, which is intrauterine insemination. So they're just going to try to get pregnant naturally with acupuncture and herbs. And usually that's a combination of a couple months of acupuncture and herbs. Now there's the other scenario, whereas I have patients that are going through in vitro. So the reproductive endocrinologist will send over the client to me. And we can't use herbs in that situation because it's contraindicated with all the hormone therapy they're doing. And they've actually done studies that have shown that in vitro efficacy rates are 70% better with utilizing acupuncture during that whole course, whatever it is, that month or 2 months that they're going through in vitro.
And is there a timing thing with that? They have to come certain times throughout their treatments for that to be successful for them?
Yeah, so say with in vitro, which is you have to do it before, and you also have to do it like within 72 hours of when they do the implantation.
And that tends to lead to higher success rates.
Much higher success rates.
Right. Okay.
Yeah.
So, and also if they're taking other medications, Clomid or other things along with their therapies, you can just do the acupuncture, but not the other part, as you
Absolutely.
said.
So we, because I have to work with these physicians that can also dictate what I have to do too. So even with cancer patients, I could treat the nausea for chemotherapy, but I have to strictly use acupuncture. And we still get great results, or the fatigue from chemo or whatever.
Well, that's interesting that you brought up cancer. It wasn't something that people would think it would be a good modality to help with people that are suffering with the ill effects of chemotherapy, and not only while they're going through the treatment, but surely afterwards. A lot of times, a common problem with chemotherapy could be long-term neuropathies, could be other issues, diabetes. Other health issues can come forth after long-term chemo or short-term chemo, even for that matter. So, working with someone like yourself to curtail some of those symptoms and some of those ill effects of the chemotherapy could be beneficial. So, how do you find those patients, working with those patients? Can you eventually, once they're off the chemo, can herbs be beneficial for them down the road, not to interfere with the chemotherapy? Let's just say they're 6 months post chemo care, and now you want to start to build up their immune systems or build up their ability to, or prevent the neuropathies or whatever other symptoms they're having?
Yeah, absolutely. So typically we use herbs after they do their chemotherapy regimen. And we also use acupuncture too. We use both. So, and it does help boost the immune system. It helps with any of the other symptoms they're having, like fatigue. And acupuncture for peripheral neuropathy caused by chemotherapy is actually phenomenal. It's actually showing a lot of promise. And I mean, I get good results. I've been doing this 23 years, so I know when it works and I know when it doesn't work.
I think everyone would want to see acupuncturist with confidence. So I think that's a good thing. And the clinical skills over 20 years, it does matter. And I think you've probably seen enough of various types of conditions. I think that's the important thing for our viewers to know is that, acupuncture is a great modality for treating multiple situations. We've already spoken about, anxiety, stress, post-cancer treatments, immune function, even like with COVID and influenza and things of that nature. And then pain, of course. And then, the big one we really didn't talk about was, and probably amongst all the patients, is digestive problems. And,
that's a biggie.
And how does acupuncture, assess and not only deal with digestive problems, but how do those digestive problems relate to all the other issues that you deal with? I know sometimes I've been to acupuncturists, they want to see my tongue a lot. They stick out your tongue. So,
that's what we're always looking at.
What's going on in the oral cavity that people should be aware of, even if they're not self-diagnosing, but say, hey, maybe I should go see an acupuncturist because this doesn't look right, So.
Right. So what we do is, digestive conditions. So we consider the digestive system, okay, this is going to sound a little weird. We consider it earth. So everything stems from the digestive system. If the digestive system is off, the rest of the branches of the tree don't function well, right? So one of the things we do is we look at the tongue. The tongue is
Can I interrupt 1 second? Anyone that understands health and science understands that food and water go through our digestive system.
Right.
So everything that we need to survive starts in our digestive system. It starts by the time it hits our mouth, right? So it makes sense, that if we don't digest well and we don't break down our nutrients and we don't process our nutrients properly, we have other issues or we're not eating the proper foods, and we're doing so. So to me, it is the center of who we are, because we need water to survive, we need food to survive. And those two items, the first thing that they do is they go in our oral cavity into our digestive system. So if that system is off, okay, or we're not treating it right by eating, bad food, processed foods, sugared foods, that's why I think nutrition, herbs, and all these other things are important. So I do want to stress, like, whether you're an acupuncturist or any other doctor, if you're not addressing what people are doing with their digestive and what they're putting into the digestive system, I think you're missing a big component of their health. So, not to interrupt you, so continue.
Oh yeah, but like with digestive system, we could treat it with acupuncture. We can also use supplements. We can use herbs. We use dietary counseling. There's a whole host of things. But especially in pediatric medicine, the digestive system is essential to look at. Like even we'll look at like pediatric asthma. We treat the digestive system, the asthma gets better. So you're looking at a potential lung issue, but we treat the digestive system and it improves. So there is a lot of, Chinese medicine does a lot with digestive issues.
And let's just use like more common nomenclature: irritable bowel syndrome, colitis, Crohn's disease, things that are really significant in the digestive world. How can you work and address with those people? And then how much of this do you also have to look at their diets and make modifications?
You have to look at diet it's essential, but you can still make corrections with acupuncture and herbs if the patient is not willing to change too much of their diet, which ask my father, who still eats Malamars and bologna, which we won't talk about that.
Malamars and bologna.
I can't. Separate. We could still work on the digestive system with things like, acupuncture, probiotics, Chinese herbs, and he still can do well. But he really should eliminate those things. It would
do better if you eliminated the bologna than the Malamars, but
I don't want to talk about it.
Any patient would.
Any patient would. Like, it's just not food, right? So, Basically I sort of go over people like try not to eat too many processed foods. Also, processed foods create inflammation in the
Dairy,
body.
Excessive wheat, excessive gluten products, not that people have to be gluten-free on everything, but they have to be more, quality foods, less processed foods, things with less preservatives in them, less dyes in them, less, everything in them. I think that's one of our major issues today in our whole health society, is that the foods that we're eating are just generally not good for us.
No, they're not. Yeah. So we call them wrecked foods. Yeah. So wrecked foods wreck the digestive system, and then eventually you stop. Your digestive system can't absorb nutrients from food because it's so trashed from all the junk we've been eating, and not really supporting our digestive system.
So it's a combination of, again, herbs and needling and correcting these pathways, as we'll call them, these meridian pathways, and connecting the dots really sounds like a key to working with a quality, practitioner, acupuncturist, someone that's going to look at your body as a whole. It's going to look at your connecting where the cause of the problem is, not just where the issue is, unless it's like a traumatic event, like you said, and it's an easy, okay, you banged your neck and now you have neck pain. That's a simple A, B,
Yeah, I don't need to do a whole thing. Yeah.
Right, but if it's like, okay, well, why do you have RSD, or why do you have a chronic interstitial cystitis? We didn't even talk about bladder.
Oh, that's a really good one. Yeah.
Issues. Those are other things that acupuncturists commonly treat, but those patients suffer for years with pain and don't always get the benefit of getting better through other modalities.
Yeah.
You want to talk about that if you treat with people with bladder and
yeah, let's just call it bladder issues, because I can't say interstitials. I can't say that word. So right now it's sort of like the latest craze with urologists is using acupuncture to treat bladder issues, especially like frequent urination, and some people experience some pain with urination that is not related to an infection, right? So we have to break it down. Is there an infection in there, or is it just interstitial cystitis? I can't say it. So, but acupuncture, so it's actually a very basic treatment, and it just basically stimulates the nerves that go to the bladder to help to control it better. And you just use like a little electric stim, and it's a couple of needles, and it's a couple sessions of acupuncture, and people get relief after a couple sessions, like maybe 3-4 sessions.
Okay, so we talk about a lot of various conditions. Now, is acupuncture something that has to be done often for it to be effective, or does it depend on the condition, or do you set a care plan for patients? Is it typically, twice a week for a certain amount of time? Like, what is the expectation for a patient that's seeking acupuncture?
So it varies, right? So if somebody comes in severe back pain, and they can't function, they can't enjoy life, I'm gonna ask them to come in a couple of times a week for a few weeks. And once the pain starts to subside, I decrease the amount of acupuncture sessions, okay? Now, if somebody wants to come in just to feel good, just for maintenance, like life maintenance, I can have them come in once every 2 weeks, once a month, depending on, it really varies with treatment, and also the age of the patient. So a 5-year-old, I'm only going to treat once a week, and the results are usually like that. But somebody my age, I probably have them come in 2 or 3 times a week if the pain was severe enough or the issue was.
I think patients should know, a decent amount, not all, but a decent amount of insurance companies are covering acupuncture now. So there is usually coverage on people's insurance. So I think sometimes they don't know that, and they don't seek the care because they feel like it's going to be a big out-of-pocket. Sometimes it doesn't cover it. Medicare, which is our federal government plan, is now covering it under the supervision of a medical doctor or a nurse practitioner. So so it is covering the modality more and more. So I think it is being recognized as a helpful and, quite honestly, a effective, not only effective, but a cost-effective method for treating patients, because some of these people that have been through so many different types of procedures or medical treatment that is very expensive, where they can feel a lot better, probably for a lot less, quite frankly. So I think it's a good option for our patients.
Yeah.
Is there anything else you'd like to touch on regarding acupuncture that we haven't discussed today?
I don't know. I'm like not thinking of anything, but I will say this. If the federal government is willing to pay for acupuncture, you know it's an effective treatment modality because they're stingy with money. So, I mean, and that just happened this past year.
Yeah.
So
well, I think they're also realizing that, again, it's cost effective. So
well, there's less sequela too. Like now you're not, okay, we're not doing surgery on Dr. Siegel, so now we don't have this, you know?
You know, an average, bill to Medicare for the typical herniated disc patient, could be X, Y, Z, and using, working with, various practitioners, chiropractors, physical therapists, acupuncturists, massage therapists. Those modalities are very, very effective, especially even when working together, even more effective, and usually at a much lower cost than like a major, spinal surgery or having people in a rehab facility or dealing with pain modulation devices or whatever, whatever the issue is. So we do thank our acupuncturists, and we feel like the modality will continue to have a great purpose in our healthcare system. So anyway, so I want to thank you for being a guest on Health IQ. It was a pleasure. I think we learned a lot about acupuncture.
Okay.
I want to thank everyone for watching our show today. Again, this is Health IQ, your host, Dr. Alan Siegel, and we'll see you next time. Thank you.